Hey guys, how's everyone doing? Today we've got a new graduate, just finished his dental school, so he's going to talk to us a few little bits and pieces about how he found dental school. He's only graduated this last week, so it's going to be really cool, really fresh to find out how he's feeling. Where's everyone joining us from today, and how's everyone managing at the moment? Who's you guys here? I'm just going to send him a request to join. Just seen Mo just join us. Where's he gone? There we go. Guys, I want to know where what everyone's up to at the moment. Let me know how you guys are doing, whether you're still in lockdown, when you're back to normal yet, or coming out of it. And Mo's joining us. Dr. Faraj, come on, man. Michelle's from Colombia. That's awesome. But it's nicer weather than England for sure. Howard's joined us. I'm going to be on the other side of the interview table on Tuesday night with Howard. So there'll be a story going up on, there's a story on my personal account at the moment. So if you've got any questions for me, then drop them on there. I think Howard's also going to do a question sticker a little bit closer to the time. So join us for that on Tuesday. That'll be really cool. I'm going to try and add Mo again. He was here. I don't know what happened. It didn't seem to work. This might be a non-starter. Here he is.
Hello.
Hey man, how's it going?
Good. How are you?
Good man, just chilling. I've been playing a lot of COD.
Yeah, I've been sleeping a lot. How was quarantine?
Yeah, it's starting to grate. It's been 7 weeks, so I'm
Yeah,
starting to get bored finally.
finally.
But thanks to the Insta fam, we've had something to do. This is our 45th live
Wow.
since lockdown began, so
This is
we've done
my
a lot of
first
stuff.
live ever.
Awesome. In India, we're now in the fourth extension of lockdown. Yeah,
Okay.
same as us pretty much. How was there as well? Loads of you guys joined us. Awesome. How does it feel to be a real dentist, man? This
It
is why you're
feels
here.
surreal, honestly. It was not what I expected. With the whole quarantining and not having graduation, I feel like it could have been better, but circumstances, I mean, just take that into consideration. It feels awesome.
Yeah.
It still feels weird. I mean, I remember the first day that we had our white coats, and like it just felt weird, like I did not belong. And now I'm at the other end, and I know that I belong, but still feels weird. Especially that we're far from patients now, and I haven't seen a patient for like 2 months. Yeah,
Yeah, I think that's kind of the weird thing about it. You know, you've had an online graduation.
yeah,
Uh, Everyone's kind of, not being able to join each other and kind of celebrate and stuff. You
yeah,
probably had like a Zoom call, something or other.
yeah. Not even they kind of pre-recorded a video, and we just watched it at our own time, kind of thing.
Mm.
It was it was not ideal, but it is what it is. I think they're gonna do something for us for Christmas where everyone's gonna probably come back and celebrate.
Yeah,
But
have to.
it
Mm.
feels good. How long have you been out?
I graduated in 2017, so it's been a few years for me. So it's
Nice.
not been too long, but I can still remember kind of
Yeah.
waiting for the results. Have I
Yeah.
passed or not passed and all that sort of thing. So yeah, I thought we'd do kind of like, you've just gone through the whole process. It's probably fresh enough in your mind that you can remember all the bits that people want to know when they're, either getting into dental school or like little tips and trips for when you're in dental school. So we've got one question from Ali there. What GPA should you be aiming for? And he's doing maths and science.
Okay. In terms of GPA, the average in the States, I would say you would want to be within at least like 3.5, but keep in consideration that that's just the average.
Yeah.
We have people that got in with 3.0, even below that. and people with 4.0s that did not get in. It's just one piece of the puzzle. Personally, I had my GPA was 3.4, which is below the average. My science GPA was 3.2, well below the average, but there are other things that you make up for it. We have the dental admission test, which is a major, also
Yeah, it's
major
pretty big.
goal to get into dental school. And once you're past the grading, I think personal statement is what gets you the interview. And at that point, it's you versus who's interviewing you. You want to present yourself as unique, as personable, as someone that stands out because they do get a lot of applications.
Yeah.
All those applications are smart people with great scores. So you want to set yourself apart by being unique. Just be yourself, honestly.
Yeah, I think I agree. It's probably similar sort of thing that we had from over here.
Yeah,
I think when you come to an interview, the guys want to know that they're basically stuck with you for 5 years or
exactly.
4 years, depending on how long the program is.
Yeah,
They want to be able to stand talking and teaching to you, and that's the biggest thing that I think. Once you've got into the interview, that's the key from my point of view. Good question, man. From I think it was Ali that dropped us that question. You had a bit of a different start though. You came all the way from like Syria, right? Is that right?
yes. So I was born and raised in Syria. My dad moved here when I was 7. Then we
Mm,
followed him about 7 years after that, and straight into high school. Had to like learn English and get into college, and it's been it's been honestly blessed. It's been very blessing to be able to make it this far. Um,
mm,
Honestly, if I can make it, anyone can make it. I'm not the smartest. I'm far from being on top of my work. I procrastinate like no one else. It's just like you want something and you just work towards it and you'll be able to make it. This whole dental journey has been insane. So when we started dental school, a lot of schools in the States right now are taking a new approach to teaching. They call it team-based learning.
yeah.
So the old school where you go and you just sit in lectures and you just spend pretty much the first like year and a half sitting in lectures and then you take exams. None of that anymore. We do not have a single lecture for the most part. We go in there, and before we go in, they gave us all kind of sources, which may be books of chapters, it could be YouTube videos, it could be literally anything.
Yeah.
And all that resources basically is targeted on a topic. And on your own time, you go and you read through it and you decipher what information you need to. And then when we got back together with everyone, it would just be case like they would just present cases and we would have questions and way more interactive, which was weird at first, but I absolutely loved it because no one wants to sit in lecture and usually lectures are super boring. So we were the first class that went through that, which
Mm.
was hard at the beginning, but it has been absolutely amazing. Um, then yeah, it's been a crazy, fun, amazing ride, honestly.
Yeah, I think the lecture versus kind of group learning thing, I think somewhere in the middle is where I would prefer it. Like
Yep.
I want to be taught the, overall idea first, and then, in a group kind of session, you can kind of wrap your head around it and ask the questions that you need to
Yep.
ask to understand things. Um, Lisa is asking, is it a mistake to answer what is your weakness question in an interview?
I mean, if they ask you that question, it's a weakness not to answer it. I feel like I don't think they ask it that often. I was not asked it. I've interviewed
Yeah.
for schools, I've interviewed for residencies. I was never asked it. I think the best trick when you're at the interview is you take charge of the interview. I mean, not be
Mm,
rude or over pushy, but just have a conversation, honestly. If you start stalling and if you just stop talking, then they go dig into the stuff that they have written down. But if you just keep the conversation going, they won't even, like, for my interviews, we did not even talk about school. We were talking about construction and music and
other
everything
thing.
other
Yeah.
than my academics because they know your academics. Um, yeah, I would say whatever they asked you, I would answer it, but just be proactive and not let it stall to that point.
Yeah, it feels like a bit of a question that's maybe like cliche, like they
Yeah,
never actually ask it. You maybe it's the kind of question you see in the movies, but in real life, unless someone's been a bit, I don't know, dramatic, no one's going to ask you that in an interview
yeah,
because it doesn't really teach you anything
yeah,
because it just puts people on the back foot, and that's not the point of an interview,
exactly.
or it shouldn't be anyway. Maybe some
Yeah,
people do it that way, but it shouldn't
yeah,
be
yeah,
the point of an interview. Um, but yeah, if they ask you that, just say I don't know, whatever's true, say that.
exactly.
How was your first year at dental school? How did you find the change from an undergrad to dental school?
Uh, so first year it was hard. It was very, very hard. The school I went to, we do combined program where we are with the medical students. So for the first
Mm,
like year and a half, we take the entire medical curriculum, including physiology, pathology, everything, full lab dissections on top of the dental curriculum. So it was a big jump, especially for me. I took a year off between undergrad and dental school, but you get the hang of it. I mean, for the first maybe 4 or 5 months, I was certain that I was going to drop out. I was like, there's no way on earth I am going to continue this. It just seems so insane, the amount of information that they just throw at you.
yeah,
It's way too much, but somehow everything works out. Everything works out. I was blessed to go to a pass fail school. So you just pass. You keep your head down, you do your best, and everything works out. I
yeah,
wouldn't
yeah,
stress
I
too
agree.
much. I feel like at that point, it shouldn't be a matter of, again, it should not be a matter of grades. I think you're smart enough that you made it that far. That's why I like the pass fail system. But it was a hard transition for the first few months. Then you make friends and you create study groups and you get into your own zone and you do fine.
Yeah, I think like the point where you're learning a load of theory and you've not been anywhere
Yeah.
near a drill, you've not been anywhere near a patient, you're just like,
Yeah.
why am I bloody doing this? This is
Oh,
boring.
yeah.
And then you're just like, once you actually start seeing the patients, then you're like, okay, this is what I came for. I'm trying to learn
Exactly.
what I want. Uh, I definitely had that same feeling. Like, I just want to sack it off. I want to do something else
Yeah.
now.
Yeah.
Until you get to that point, and you're like, okay, okay, this is the real business.
Yeah,
Um,
for me it was even because like we were literally like dissecting arms and legs, and we were talking about all kind of different stuff. We're talking about pneumonias and UTI, everything. And we're
mm,
like, we're not here for this. Like, we want to get to the next part. But I think it's very crucial that you learn these basics because you're dealing with a human being. You're
yeah,
not just dealing with a tooth or a mouth. But once you get past through this, the dental hands-on stuff is fun. I absolutely enjoyed every bit of it.
yeah. I think you need a bit of both, like to keep you
Yeah,
interested as you go along. Um, but yeah, all the other stuff, drug interactions, it matters at some point, once you're treating people. So you
absolutely.
do need to do it, but it's not the most fun when you just want to go ahead and do some composite fillings or
Yeah,
crown preps, whatever it might be.
abs-
Um, did you find like I always found that actually the biggest difference was more like the outside school life, more like
yeah,
doing your laundry, doing your where am I getting food from tonight? Do I have to
yes.
cook?
Loved cooking, and that was an issue. First year, I was lucky. My mom lived about an hour away at the time, and she would kind of meal prep for me. And
Mm,
I tried going to the gym as much as possible, but like you get before an exam, the week before an exam, you're just in the library for like 10 hours a day. You just do it. Social life becomes different. You become within just that bubble of your classmates at school. Our class was 50, and you're pretty much with them every day, all day for those 4 years. I mean, later, third and fourth year, you have a little bit more time, but yeah, the first 2 years where you're just doing a lot of, book studying. Social life is very minimal. You try to keep yourself sane as much as possible. If you have a hobby, you try to do it even just once in a while. It's just for your own sanity. But it's
yeah,
definitely a big transition between just yeah, what undergrad is, where everyone just got a lot of time, and you come to professional school and your time is limited. the expectations are higher. People expect more of you, and it's a lot of pressure.
Yeah, it's a whole different kind of feeling, isn't it, compared to when
Yeah.
you're back in high school and everything's done for you, and you know it's really simple. You just got to turn up every day and then go to the exam, and it's all good. You really got to take it into your own hands. Thanks, Michelle. Yeah, thank you for joining us. Sharon Nora's asking best degree to get into dental school. Now, it's a bit different for us because we went straight from high school at
Right.
18 and
Okay.
we went straight into an undergrad dental program. So we spent 5 years, you know,
You
and
got
we didn't have to do an undergrad, thankfully.
Yeah. So in the United States, it doesn't matter what degree you have. There are certain requirements that you need to get into dental school, but you can be like an arts major. We had
Mm.
people in our class that were business major, that are engineers. They just have a minimum requirement. Like you need biology 1 and 2, chemistry 1 and 2, organic chemistry. I think they included biochemistry, some type of calculus. You need it, but it doesn't matter what degree. With that being said, I think that having a degree in a science field definitely helps you a lot, especially biology. I was a bio major. A lot of the students are either bio or chemistry major. At the end of the day, everyone does fine. It just makes it easier in terms of taking the DATs, in terms of the first few months where you're just lost. At least you know some of the language that they're speaking to you. But
Yeah,
if you're passionate about something else, by all means, go for it. Just have those minimum requirements. I don't think they care. And it would be
yeah.
easy for you to get a higher GPA with a non-science major.
Yeah, I think it's, you know, if you're going to do one and you think you want to do dentistry, then uh, for sure, biology, chemistry, that kind of thing is going to make it so much just easier for you.
Absolutely.
Just in terms of ease, you know, if you're interested in something else, then maybe take up, you know, another class in that as well. But if you know you want to do dentistry, have kind of start with the end in mind and just make your life easy. Um, that's what I would say. Obviously, there are people out there who have done um, non-science entries and
Yeah.
stuff like that. There's a couple of guys I can't remember off the top of my head, but if anyone's interested, I'll try and find those profiles. I'm sure I've featured a couple of those guys. So
I mean,
if you're
my dad,
interested,
the
then
that I shadowed, he was an engineer. And then after he graduated, he decided to go into dentistry, and they looked at him, and he didn't even have to take DATs. But yeah, it doesn't matter, honestly. If you know you want to go into dentistry, obviously science field would be better, but a lot of people don't know until after the fact, and it's okay.
yeah, that's part of how it goes down. If you don't
Cool.
know, then you don't know. Um, you just got to do the best you can at whichever
Uh,
stage you work out you want to do dentistry, or if you want to do something else, it's the same for that.
yeah.
Revision for you is asking which dental school did you go to? I think I didn't actually ask you that. I just said you're a new grad. It's awesome.
Uh, Thanks. I went to the University of Connecticut. It's the State School of Connecticut in Eastern United States. It's I don't know the exact ranking, but it's high up there. Not that it matters.
Mm.
It's one of the few schools like Columbia and Harvard where they do the combined program with the dental and medical curriculum.
Yeah, that's answered the question perfectly. Is it ever too late to go back to college, do you think?
It's never too late to do anything in life. We had some of our classmates were married with kids, some that went to the military and they came back. They're like in mid not mid 50s, mid 30s, but even mid 50s. Like it's never late. It's what it's more education, more fun, more memories, and more awesome people in your life. It's never
Mm.
too late.
Yeah, I think as long as you've got
Yeah,
that passion to go ahead and do it, then you know what's the to stop you. Obviously, personal circumstances, we can't comment on those, but um, there were guys who were 35, 40 in my university, so
yeah,
for sure there's definitely kind of opportunity there, and they do take people on as long as you can show that you've got what it takes and you're, you know, really interested in it and all those kind of things. So yeah, I would do it if you want to really do it.
absolutely.
Loads of people saying congratulations to you, man.
Thank you so
So
much,
many
everyone.
saying come to
Thank
Germany.
you much. I would love to. I actually was planning on going to France this summer, but you know,
RFP plans.
yeah, yes.
um, does studying dentistry come with randomly staring at people's teeth to you?
I'm not sure I understand the question. Is it like saying how did I choose to become a dentist?
No, as in like, once you start
Yeah,
diagnosing people's teeth and then you
yeah,
start doing it outside of school and
okay.
you're like, you walk into, I don't know, you sat on a bus and
Yeah.
you're just looking at everyone's teeth, go, oh, they need this, they need that.
It is the first thing I notice.
Yeah.
Absolutely. First thing I notice. It's like there's a filter and everything is black, but you just see the teeth. Um, I wouldn't say diagnose people, but definitely something I would notice right away.
Mm, yeah.
If someone has,
I think you already noticed it before, but if you think, oh yeah, I want to do dentistry, then before you've even started, you've already been kind of
yeah.
eyeing
I
people's teeth up,
I
going,
always
oh,
do the thing with older people where I'm like, is that dentures or are they real teeth? It's
mm,
hard to tell sometimes. I don't know. Teeth are like literally the first thing I notice. There's just very, very important to your confidence, the way you look. Overall, teeth are just really important.
yeah. I think there's always like, I don't know how many times you had this in dental school, whether you did, I don't know, something where someone's missing a tooth
Yeah.
somewhere in the smile line, and then you fix it up, and then they just regain confidence, and they're like, oh
Absolutely.
wow, it's a different. That's like a different person that's walked in and walked back
Absolutely.
out.
Yeah, you have these patients. I had to like extract over 20 teeth on this lady. She was like in her early 50s, and she cried when I told her that I needed to extract her teeth because they were no good. And she cried when I gave her dentures because she was so happy to gain her smile and confidence back.
Mm, yeah, it makes a big difference to people, and they feel like they can go out to, I don't know, even just to go out to eat or like go and socialize. Changes things for them.
Absolutely.
Um, Dr. Follock is saying congratulations again.
Thank you so much, everyone.
Right. So while everyone's saying congratulations, I'll ask you some questions.
Go ahead.
Yeah. So like, do you think you're gonna do general dentistry, or have you got an idea in your mind about doing some
I
specialty
already,
training?
I already, so I'm gonna be a prosthodontics resident in July. So when I started dental school, I came in with the idea that I wanted to do pediatrics. I loved
Mm,
kids. I have my nieces, and I just loved working with kids. And then we had our pediatrics rotation, and kids do not like dentists. And I feel like the type of procedures you do on kids are not as complex as I would want to do. Then we started doing dentures, we started getting into implants, and I absolutely love prosthodontics. I feel like
mm,
they knew how to treatment plan any patient, regardless of how complex the treatment plan is. Um, so yeah, I decided I want to pursue prosthodontics, and I'll be starting in July, hopefully.
where are you gonna be? Where are you
Same
gonna be working?
university.
Same
University.
university. Awesome.
Yep. I've been there for 8 years, and I've just signed up for 3 more.
How much of the university have you paid for? How many buildings?
A lot, and they keep renovating. It's a lot. Yeah, 11
Yeah.
years, same school.
Yeah, Pros is an awesome kind of career. Is that going to be including placing implants as well, or how does it work over there? Because some places
So,
it's periodontist to do that.
so here, anyone can place an implant.
Mm,
Perio are known to be very good at placing implants. Obviously, surgeons also. Pros over, I would say, the past maybe 2 decades have stepped up to the plate because they are experts in restoring the implants and restoring
mm,
the mouth in general. So it made sense that they place their own implants. Um, so there's two types of school prosthodontics. Classic prosthodontics, where they do classic, they do a lot of research-based stuff. They do a lot of fixed and removable prosthesis. And more progressive schools, they do a lot of surgeries. At my school, they do over 70% of what they do is surgical placement of implants. They do
yeah,
like sinus lifts, bone grafting, you name it, like all on four, all on six. They do a majority of what they do is implant related surgeries,
yeah,
and they work closely with the perio and the surgery departments. Um, so we get the perspective of the periodontist and the surgeon as well as the prosthodontist. So you get more of a complete picture from the biology aspect as well as the restorative aspect.
Yeah, because sometimes like it's going to overlap the idea of being
Absolutely.
prosthodontist, periodontist. If you're replacing implants, you're kind of somewhere in between.
Absolutely.
Um, and I think it's kind of cool because then I hate dentures. I'm just going to put it out there. I can't
Yeah,
do
yeah.
them. I just don't
There,
like doing.
no, dentist.
Uh,
I love doing dentistry. I love the waxing. It's just so relaxing to me. But they are annoying, and I feel like in private practice you don't really sit in the lab and do any of that stuff. You just send it to the lab and they do it.
mm,
But they are annoying. They're annoying to adjust. They're just in general not the best.
yeah, it's like a dark art. It's like you know I like endo, and I
Ooh,
feel like I know what I'm doing with endo,
ooh,
but
not me.
putting some impression material on the tray,
Mm.
I just
It's
it's
too
not for me.
it's too messy and I don't know. It seems arbitrary, but I'm not an endo guy.
Mm.
Absolutely not. Mm-mm. I mean, everyone has their own niche. That's why we have specialties because people love different things. I don't know
Yeah,
how it is in other countries, but here there's more and more specialization nowadays.
I think it makes sense because if you've got loads and loads of dentists, yeah, you need somebody who's gonna look after general checking and stuff like that.
Yeah.
But just kind of touching on what Dr. Himani's going to be saying actually there, yeah, you can have one dentist, you can have a hygienist, a couple of hygiene therapists who are going to be doing some of the fillings, going to be doing some of the the cleanings, stuff like
Yeah,
that. And then the general dentist is going to do the majority of the more complex work, and that's how you can have an office that works really nicely.
absolutely.
Um, but then if there's a curved canal and you're doing a
Yeah.
bit of everything, uh,
It's just not
I
worth
wouldn't feel
your time.
comfortable doing it if I wasn't at that level.
Yeah, exactly. It's not worth your time. It's not worth the risk. There are
Mm.
people that do it way more often and they're specialists. They have way more.
People who like doing it.
Exactly. And that's why you build up your experience. Like you challenge yourself as long as you're not harming the patient. You just follow the principles that you know to be true. And that's how you build your experience. I mean, the specialists, that's how they did it. They just did not become specialists without practicing.
Mm. Ali's got a question. Ali Palestinian. He's asking, my brother, what do you think about implants? Um, I think that's from a non-dentist point of view.
Okay. Um, I think implants is becoming one of, if not the most, one of the most common treatment option.
Mm.
I think it makes sense in terms of preserving teeth. I mean, the old school was just prep both teeth on each side and do a bridge, and you are taking away a like
I love
good
to.
amount of sound tooth structures just to place that tooth. And their success rate is over 95% now, which is just as good as a crown or an endo treated tooth. So there is no reason not to pursue that. I know in the United States it's expensive and the insurance doesn't
Mm.
cover it. That's what deters most patients from getting it. But I think it's an amazing treatment plan option.
Yeah, I think if you've got a tooth there, first of all, try and save the tooth. I think
Yep,
that's the natural tooth is always better than a non-natural tooth.
absolutely.
If you end up having to lose a tooth, then so be it.
Yep,
But I wouldn't be starting cutting around other teeth because if you cut around two teeth for a conventional bridge,
yeah,
then 2 out of 5 chance that
yeah,
that tooth then dies and needs root canal or you lose it. So you
exactly.
could end up, with like a knock-on effect of just like losing teeth left and right.
Yeah,
Whereas that gap, you can put an implant in there. Like
yeah,
you say, it's some guys are doing a 98% kind of success rate once you get really good.
absolutely.
Um, then you can be like, okay, well, let's stick an implant in there. It's going to do the exact same thing that a tooth did.
Yeah,
As long as you keep it clean, it's going to be perfect and could even last you your entire life, depending
ab-
on how old you are.
yeah,
Why
I
not?
agree. Yeah.
But
There's,
yeah, it could be like a $10 if you really stretch it out
what is it?
per year cost. If you think
Oh
about
yeah,
like
exactly. If you stretch it out over 40 years,
maybe not $10, but yeah.
yeah, they are pretty expensive.
Awesome. Good question that. Dr. Hermione was asking about being in dental hygienist. We kind of touched on that. We were saying, it's a valuable part of the team. Really, I would struggle to, be as efficient as I am now. Well, when I'm actually working, I'm sat at home doing nothing for the last few weeks.
Yeah.
But it'd be very difficult to be very efficient if you had to do all of your perio treatments. It takes an hour, hour and a half
And you're doing
sometimes.
your own, yeah, it just doesn't make sense. And they're very good at what they do. I think a general practice without a hygienist is just not ideal. It's just not ideal.
Yeah, and in the UK, we have something called hygiene therapists
Okay.
who will do simple fillings as well,
Oh,
So, like small occlusal, it's going to take you 20, 25 minutes if you have to bring the patient back or something like that.
yeah.
Then you say, actually, you can see the therapist. They'll do your clean. They'll do this. They'll do that all in one go for you.
I think
And
there,
then you're free to see another patient.
yeah, I think there are some states that do that here.
Mm.
There's always dispute, like in terms of who gets to do what, but some states have hygienists doing simple fillings and stuff. And it kind of makes sense, depending on the area where there's a lot of dentists, or it makes sense. They do go through a lot of training. And I think dental hygiene as a career option is phenomenal here in the States. Like they pay very well. You have a very flexible lifestyle. And if you don't want to go through the 8 years of school and become a dentist, dental hygiene is just as awesome.
Yeah, I think it's just as reward. Well, in some certain aspects, just as rewarding because you can make a big change
Yeah.
to people, and it's relatively, like once you get there, 9 to 5 job. You're not having to do late nights, nothing like that.
Yeah.
It can be pretty cool. You can, have a good social life and stuff like that as well. So,
Yeah.
um, why not? Let's see. Another couple of questions. James Thomas, why do factors like smoking reduce the success of implant osseointegration so significantly?
Wow. Okay. Perio 101.
Yeah.
This turns
Good thing
out
you've just done finals.
like the board exam. Um, so smoking interferes with the way that blood clots. It interferes with neutrophils, and basically your ability to heal is not ideal anymore. So
No.
the way exactly, so your bone around the implant would not heal as well, and that's why you have high risk for failures. That's as simple as it can be, I guess.
Yeah, I think I'm going off the top of my head. Next Saturday, 7 p.m. We have a specialist in implantology, so that's the one you want to come and watch
Yeah,
if you're interested in implants. You're going to get a much better answer than two young grads like
yeah,
us, because he's doing everything. He teaches on courses basically, so he's that level, like a master's kind of implants. So, James, if you want to hear all the implant kind of chat, then join us for that next week. 7 p.m. BST. So I don't know what that is wherever you are. Let's have a little look. California, they do ITRs. Yeah. Awesome. That's 7 p.m. BST. If you look on my story, it'll come up. We've got loads of guys this week. I think every day I'm going to be doing something. It's going to kill me.
it's fun.
Any more questions? Let's have a look. Not at the moment. Just a few people just chatting and giving lots and lots of emojis. Something or other. What do you do like outside of dental school and dentistry? What's your how do you chill?
My go-to pleasures are basically they are revolve around food. I love cooking. I love eating. Whenever I go and spend time with my family, we're eating.
Yeah.
Spending times I'm eating. I'm between like eating or the gym. I love reading. A little bit of singing, um, photography. Just keep busy. Most of what I do, I can do by myself, just
Yeah.
because that's how it was in dental school. You don't really have a big circle of people to go and do things with. So yeah, I've learned to kind of be happy and content by myself, which I feel like is very important. But yeah, being active
I
and
think that's an important skill. Getting to a point you're comfortable in your own company,
absolutely,
uh, especially once, you start leaving your undergrad when everything's a bit of a party and,
yeah,
everybody's, always around all the time. Everyone's got free
yeah,
time. I think we got to a point in my third year or fourth year of dental school, I think third year it was, where people are starting to get really serious, and they
Yeah.
were spending the entire lives in the library.
Yeah.
And when they do have free time, then their, I don't know, girlfriend, boyfriend, whatever it might be,
Yeah.
they have so much time for all the other friends and stuff like that. So you got your close circle, but if they're busy, then what do? If you
Exactly.
can't chill with yourself, you're
Yeah.
stuck. Uh,
You're stuck with yourself for the rest of your life. You better
yeah,
learn how to get along with yourself.
yeah. Until you get married, then you're really,
They're stuck
you know.
with you.
So you got to pick the right one. But yeah, so these are really important things. So you get to a point where you're happy to go to. I found I was happy to go to a coffee shop by myself, or like to an actual restaurant and have a.
Yeah.
I've been known to go have a 3-course meal myself, by myself. I
Oh,
sit there on my phone and just smash
I
it. Why not?
worked in restaurants pretty much my whole life, and eating alone is something I enjoy. I actually hate eating with people. As like if I'm sitting with you and you're not eating and I'm eating, I would not eat. Like either we're both eating or none of
Sure.
us are eating. Absolutely.
Yeah, but it's definitely important because it's like mental health. If you can't chill, if you haven't got your self-confidence to do things like that, then you need to find a way that you're happy in your own company.
Absolutely.
Um,
I mean, I
yeah,
just enjoy going on hikes, reading a book, whatever it might be. Just keep yourself busy.
yeah. But for me, I go and watch football by myself.
Yeah.
Like, to be fair, it's in a stadium and I know a lot of people there, but
Yeah.
I
Yeah.
go. It's not like I go in a group,
Exactly. You're just,
but I'll go by myself. So that's one thing that I would do. Someone's saying you've got good cooking skills. I have
I
to check
try.
that out.
I try, but it's nothing special.
Nice. Um, any more questions for Mo? Let's have a look. Nothing at the moment, but
Think
yeah.
specializing or no? Are you thinking about specializing?
I think we had one. I think there was somebody asking about. Hold on, I have to scroll. Oral surgery. I think it's kind of everybody does a little bit, really. All the specialties do a little bit. So orthos will be exposing, uh, impacted teeth. Periodontists, would a lot of their work is surgery based, flap surgery.
Yeah.
Prost, everyone's doing some implant work. Endos are doing root end
Yeah.
surgery. So
Yeah.
it's kind of there's a bit of everything there.
Absolutely. I mean, it would be ideal if you can be good at everything, but it's hard. There are some like old school dentists that just have so much experience that they
Mm.
have managed to become really good at most things, but in this day and age, it's hard. I think it makes sense that you specialize and become really good at something.
Yeah, I don't know what kind of your experience was in dental school. We didn't see a lot of patients compared to previous generations for sure. Like there was some of the clinicians who were teaching us who went to our dental school as well, when
Mm.
they were students, and they were saying, yeah, we used to do, same building 25 years earlier. They were like, yeah, we did literally 30 or 40 times the number of patients or number of procedures than you did.
Yeah,
Um,
we definitely nowadays are not getting as much experience as we should be getting in dental school.
mm,
I mean, here in the States, finance is a major issue. I mean, even though we have reduced pricing at the school, but still expensive. I mean, teeth in the United States are very expensive. Whatever you're doing, it is a limiting factor. But yeah, in general, definitely way less patients than our preceptors had, which sucks because, I mean, you need to see patients to become better at what you do.
yeah, and then it becomes a problem afterwards. If you only done something once or twice,
Yeah.
not gonna be amazing at it at that point. So
Yeah,
you have to go
exactly.
really kind of really slowly to start with, and then
Yeah.
obviously the whole learning curve is still going, and you're actually having not much backup and support, so it might be difficult. You might get
It,
into trouble by doing things,
yeah.
uh, which is worrying. But hopefully, we just take things
Yeah.
nice and slow.
The goal of dental school is to give you basic information to be able to practice on your own without harming people. You're not
Yeah,
going to be the fastest, but you will get the job done without harming people.
yeah, for sure. Murray Muskin, what type of patients do dentists hate to see?
We love all patients.
Yeah,
I mean, they're patients. It's not a love or hate relationship. They're coming in there for a specific reason. They're coming in there for care, and you provide care, whether you agree with that person's point of view, whether you like them, whether you don't. You just give the care just like you would
the
give to anyone.
same. Yeah, same as anyone else. Yeah,
Absolutely. I mean, personal pet peeve of mine, if patient doesn't show up, it's like you're just wasting my time, and I don't like that. But other than that, like, all patients are the same.
yeah. I think there's. I think that's definitely something. You know, the one that gets me is when somebody turns up. They know they're 10 minutes late, 15 minutes late,
Yeah,
and they know that the next patient is already sat there, and there's
yeah,
5 minutes left of their appointment,
yeah.
and they're like, "Oh yeah, can I still get seen?" And it's like,
Nope.
no, no.
Yeah, I think that's one thing that I was taught in dental school is time is money. I just you learn how to value your time more than anything.
Mm,
It is more valuable than money, more valuable than anything else. And it goes both ways. I mean, I hate waiting for the doctor when I go see a dentist or a doctor. I hate being in the waiting room for a long time. I think it's important to respect each other's time. It just makes everything efficient. Obviously, there are circumstances that come up, but you know, those people that just have tendency to just not care. I think,
yeah, our software has this thing. So on my
yeah,
surgery, it's the software. It tells you this patient tends to turn up X minutes early, X minutes late, or on
yeah.
time. Exactly. So you know when they turn up. It's so you're
You
like, yeah, they're
tell
always
them
late.
like, this is your trend. Don't
Yeah.
put it on me.
Especially annoying because every time someone comes in the UK, they have new paperwork to fill out every single time.
Every
It's not
time.
like I've seen this patient before. I know the medical history.
Yeah,
They
yeah,
have to fill out a new form, so that could take 5 minutes. And if they're already late, then
yeah, yeah, exactly.
it's no
So
thanks
every time
please
they
to them.
come, there's like an updated medical history form.
In case anything's changed, it's got to be
Yeah.
up to date. So you can't go off a medical history that was done 2 years ago, for example, even if nothing's changed.
I mean, yeah,
They
for
have
us,
to.
we ask every patient if anything has changed, but like we
Mm,
don't go through the whole. Just ask like the major things, make sure that nothing's changed, the patient's not taking any new medications, uh,
yeah.
and we just update the form. Do you guys take vitals at each visit or no? Or depending on.
No, we don't. We don't really take vitals. Not really.
Mhm.
Unless people are doing things like sedation,
Okay.
where we really need to know what's going on.
Yeah.
Just for a simple checkup is it's not really the done thing. I'm sure there are people maybe out there who maybe do.
Yeah.
Maybe there are some guys out there, but um, yeah, not routinely for sure.
Absolutely.
Um, do you guys do that?
So at the school, they make us do that. In private practice, I would say majority don't, unless
Mm,
you know that patient has medical history, significant like hypertension, or they have a heart problem, or they have any kind of important medical condition. And
yeah,
depending on the procedure you're doing, if you're doing sedation, if you're doing third molars, if you do anything that is kind of more invasive than normal, then yeah, just
yeah. You want to know.
keep baseline before and after. Yeah.
Yeah, so I think in terms of people we don't like to see, we don't mind seeing anyone,
Yeah.
but don't
Some
take it
patients
for
might
granted.
say us, but yeah,
Yeah, or maybe there's certain treatments you don't want to do, and
yeah, exactly.
they'd rather went
That's
elsewhere.
that's
That's a different story.
yeah, that's a different story.
Dentures. What other options are there except post graduation after you've done your dental school? You can go into normal practice straight away. That's the other good option.
Yeah, I mean, there are a few ways you can go about it. Here in the States, most most states require at least 1 year of residency to become a general practitioner. Depending on
Mm,
states, you can just go into private practice right away. You can go into teaching. You
yeah.
can you can open up your own lab. You can go, but yeah, majority just go into private practice or corporate practice and start doing dentistry.
Yeah, I think there's options. People go abroad sometimes, if they think, "Oh, actually, I want to see how dentistry's done X, Y, Z." People do, they do the overseas admissions. I
Yeah,
think that's quite cool to do that sort of thing to go to. refugee camps, and give basic treatment to people who literally can't afford it. And that's I think that's really worth looking into as well. You
Yeah,
can do that alongside whatever you're doing, really. I think it's
exactly. Yep.
definitely something that is worth doing for everyone, really.
Yeah,
um, what if the patient's scared of the dentist? So what do you think? What's your go-to kind of
so
method of
I
getting one
think
calm?
majority of patients, I wouldn't say scared, but they don't like going to the dentist, and that's understandable. I hate going to the dentist myself. You don't want anyone just probing around your teeth, and you have all these crackling and scratching noises, and you just
Mm,
uh, for me, I hate getting my teeth cleaned because of that. But they know that they're there for their own good. They appreciate the work that you do. Yes, there are patients that are scared, and I think just having a conversation, whether it's the first time you meet them, and they need to trust you. I think that's the most important thing. If they can make connection with you and trust you, then the anxiety would be so much lower. I think that's the first option. Obviously, you want all your patients to trust you and have that connection with them. But there are other things that we can provide, like you can do nitrous, you can do oral medication. But trust, 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 and being very clear to the patient what you're doing. I think a lot of the anxiety that a lot of patients have is they show up and they don't know exactly what's going on. Exactly. They
mm,
don't know what tooth you're working on. They don't know what's wrong with that tooth. So I think spending time with the patient, showing a radiograph or having a little drawing, explaining what you're doing and why you're doing it and why it's important to do it just relieves a lot of that anxiety.
yeah, yeah. I think there's kind of like a balance as well, because sometimes I've had it where the patient goes, "Does something need to be done?" And they don't know, they don't want to know what's going
Yeah.
on. They just like get it done fast. I don't want to know.
Yeah.
Do it.
Yeah. You,
Sometimes it's like they don't want to know because it seems more graphic in their
yeah,
heads once they start saying, "Oh yeah, and we're just going to do this and that." Um, so it's one of those you have to work out between you and the patient, work out what kind of person they are.
absolutely.
Sometimes it's like actually they literally want to be the most ignorant person in the world and just want to,
Exactly.
I'm having a feeling today, I'm having a crown today.
Yeah.
That's it. Um,
Exactly. You have. This is why it's important, like to know your patients. I guess. Yeah. Just
yeah,
having that
you have to
conversation.
have the chat
Know
with
what type
them
of,
and stuff.
yeah. Absolutely.
Did you always want to be a dentist?
Yes. So I have my brother. He's a year older than me, and when we were in high school, he wanted to be a goalie keeper, like a football goalie keeper, and my dad was like, "That's not gonna happen." So they had this whole ordeal where he wanted to go into that, and my dad was like, "Either you're gonna come and work in my construction company, or you're gonna become a doctor." And it went back and forth for the longest time. And I was like, "I'm not gonna even have this argument with my parents." I knew that I loved working with my hands. I mean, I grew up fixing bikes, working with dough, and just loved working with my hands.
Mm,
So for me, it was like either going into mechanical engineering or something like that. Then someone pointed out dentistry for me. I was like, okay, I'll check it out. So I went and I started shadowing this dentist, and it was so boring.
yeah.
Just from the outside perspective, you don't know exactly what the dentist is doing, and just boring. You're just standing there watching the dentist do his thing. But the thing I got from it, I got that he was very happy with his career. His family was very happy. He had time to spend with his family. I liked the lifestyle. I loved how appreciative the patients were, and the environment was very rewarding. So I had my mind set on dentistry since high school,
Yeah.
and then I just pursued it, and I was like, did I make the wrong decision? Up until like the second year of dental school, because you don't really get to actually do dentistry that much until up then.
No.
Then we started doing that, and it was actually the dentures course that I just fell in love with dentistry. And that what made me want to go into pros and just learn more about dentistry. But it's hard to know if you really like something or not. For me, it was more of I wanted to be able to control my life. I wanted to spend time with my family, and that was very
Mm,
important to me to have my own autonomy. But it turned out that I absolutely love it, and I just like love the actual dentistry aspect of it. But I think it's definitely hard. Shadowing helps, asking people helps. But I don't
Yeah,
know. How did you decide on becoming a dentist?
I honestly don't really know. Honestly, people will ask me this question. I honestly don't know why or how I chose it. I know there's a point in time where I was like, oh yeah, I want to be an architect. And then I
Mm,
went on a work experience with my uncle. He was working in a nice firm. And I realized I have no interest in building other people's houses. I just want to design my own house.
yeah,
So that went out the window. I wanted to be a football player as well.
yeah.
So
We all
yeah,
did.
of course you do. You're 12, 13. You're just like, oh yeah, I want to be Ronaldo, man.
Yeah, I just want to be a millionaire, just the
um,
best player in the world.
and yeah, I was pretty good, but then um, the other guys were really good who were
Yeah,
getting on trials and stuff. And I was like, okay, yeah, that's not going to happen.
yeah,
And I was like, okay, well, probably medicine, probably dentistry, something like that.
yeah,
Um, and then I was umming and ahhing, and then I don't know, just like I made a snap decision of, you know what, dentistry, let's just do it. And
yeah,
I wrote the personal statement. I've been on the work experience already,
yeah.
but I honestly didn't. Oh, my phone almost fell. I honestly didn't have a clue, like you, what was going on in the actual dental surgery because I sat there. There was something called UK CAT in the UK,
Okay,
kind of like DAT, but a
okay,
bit different. It's like an admissions kind of test that's
okay.
universal for all the dental schools.
Yeah.
I sat there with one of those books, and I sat in the corner of my uncle's surgery, and I just revised. I didn't
Oh,
look in the mouth once. Uh, I only stopped for lunch when we went to the restaurant at lunchtime, so I had
yeah,
no idea what was going on. I was like, oh yeah, I'm just doing dentistry, so uh, I hadn't got a clue what was going on.
yeah.
Honestly,
It's hard.
no
You
clue.
don't know really until you do it.
No, and even throughout dental school, I hate shadowing.
Yeah, yeah.
Um, I
It's
was like,
boring
what's the point in me watching someone do something that I should be learning to do and
doing.
just doing it? I'd
Exactly.
rather have the person just sitting on my shoulder, go, all
Yeah,
right, now you move your hand this way, now you move your hand that way. This is how you
yeah,
do it. Um, so I think it's useful for some things when you're just like, oh yeah, you want to see some max fac surgery. There's
yeah,
no chance you're going to do that.
yeah. Exactly.
So to actually see that, that's pretty cool.
Yeah, but I think it's
Um,
important to even just going for a few times, get the perspective of the life of a dentist, I guess. Not
yeah,
dentistry itself, but the life, the way they interact with the staff, the way they interact with patients. If you can get a glimpse of how, like, the family life, all that, because that is very important. I mean,
mm,
yes, dentistry is very important. That's going to be your career, but that's not going to be your only thing to do in
no,
life. All the other stuff is just as important, if not more important. I view dentistry as a tool for me to have the life that I wanted.
yeah. I think that's the same thing. It's like I thought, okay, if I do medicine,
Hmm.
they're going to make me do night shifts, and I don't like going to work at
Hmm.
night. I
Exactly.
don't
I
want
like.
to do that. So I
Yeah.
was like, okay, I'm not going to do that.
Yeah.
So I was like, okay, that makes it a bit simple now. But I think if you're wanting to understand what a dentist does,
Yeah.
Instagram and YouTube weren't really where they were when I
Absolutely.
was applying
Yeah.
to where it is now. It's over 10 years ago.
Yeah.
Um, so you can go on YouTube, you can go on Instagram and just see, okay, this is what they do.
Yeah.
And the actual, physical, how you do it, etc., you'll learn. But if you like the idea of it, then sweet, go for it.
Yeah.
And I think dentistry is something which is really, really flexible. So you
Absolutely.
can be as obsessed as you want or as unobsessed as you want. It just depends on um, how what kind of person you are. Are you someone who just wants to go to work, come
Yeah.
home, and then finish with it? Or are you someone who wants to go crazy and become like a specialist and go to conferences and write papers? There's all kinds of options for everyone out there. I think
Yeah.
that's kind of like it's so open ended. That's kind of why I like it.
Yeah.
Now that I think
You
about
can make it your own. You can customize it to fit your own
mm,
personality.
yeah. I mean, there's people who are doing really well by you know. I like to kind of have chats with people, so I'm doing all this Instagram stuff. So
Yeah.
it's really cool to have different guests on and see how everyone else
Yeah.
is doing. Sometimes it's a chat like this. Sometimes we have like a specialist and they'll come on, um, like and show us X-rays and say, oh yes, and now I did this, now I did that. Then this is
That's
how you do X, Y, Z. So we've had like full-on tutorials of whole treatments
that
just
is
in the sat at home.
yeah.
Uh, so there's so much options now.
That is
Uh,
yeah. Things have changed. I think for the better.
Favorite dental treatment. So it sounds like dentures for you, man.
I do like dentures. They are complex, they are annoying, but I think they they're like very transformative. You change someone's life, giving them a new smile and whatnot. Although they're not the best treatment option in terms of like functionality.
Yeah.
Um, if I had to choose one treatment that I absolutely love, it's hard. I love prepping teeth, crown and bridge work. I absolutely love it. Just holding a drill. I also like extractions a lot. There's
Yeah.
something satisfying about extracting a tooth when it goes right and doesn't bother you a lot.
I
But
think that's that inner satisfaction. That's what I
yeah,
get. Like once
exactly.
I've done the root, yeah. So someone's written root canal down there.
Yeah,
So once I've got those X-rays, I've got them. You know, I can look at them anytime. I'm like, yeah,
literally.
that was a good one. I remember that one.
Yeah,
Uh,
exactly. You remember the stuff. I mean, like, I remember the bridge I did, it was like an anterior bridge. And honestly, every procedure that I did in dental school, whenever I went to bed at the end of the night, whatever I did that day, the whole thing would kind of play in my head. And if it went
mm,
well, I just felt good. And if it did not go well, I'd be thinking, like, what could I have done better to, like, remediate or just do better next time? And I can't say that there's anything that I hate doing besides endo. I just hate the fact that I can't see anything. Like it's just weird to me.
yeah, I have a microscope, so that changes
That yeah,
your life.
yeah.
Um,
Do you
I'm
do your crown preps with a microscope?
I do everything with the microscope.
Wow. Yeah,
Everything.
we just have the loops. That's it.
Yeah, I think it's one of those things I can take a photograph as soon as I
Yeah.
see a crack, as soon as I see anything in the mouth. So it just works for me that way. And
Did
then
you guys
obviously I
practice,
know I want to do endo.
do you practice with microscopes in school?
Yeah, yeah, we did a little bit. You didn't have to, but there were a couple. One half of the clinic had a microscope. There's one roll-on one, so I
Okay.
would use the roll-on one because my surgery in the dental school didn't have one.
Yep.
So I would use that for all my root canals when I was doing them, and it was just like, this is so cool. I can see down the end of the root,
Wow.
um,
Yeah.
and it's fun once you
Visibility
get.
was made. Like my first root canal was on this lady. She could barely open her mouth, and it was number two, and I could not see a thing. Like the
Mm,
faculty had to come in, and she put the files in the canals, and she's like, "Do you see it now?" I was like, "Still cannot see it." Yeah, obviously, just having visibility is important. I'd like I I think if I was good at doing root canals and I could do them good, I think root canals would be the most satisfying because they're very intricate.
yeah, I think even if you're not gonna do endo,
Yeah,
it's worth getting a scope these days because of
absolutely.
the level of work, the margin that you can prep
Yeah,
with a microscope compared to the margin you can prep with standard loops is
yeah.
completely different. Oh, 2 minute warning. Two
Okay.
minute warning. We've done 58 minutes, man.
Wow.
But
Wow.
yeah, I think that's magnification is just the key with
Yeah,
everything. Any last questions down there, guys? Thanks so much for coming on, man. This has been
absolutely.
really
Thank you
cool.
for having me. To
I think
everyone,
the guys have got a lot of stuff from you.
thank you so much.
Somebody saying community is what made her choose dental school. So yeah, she's chosen dental school because of the community online. I think that's a lot of it.
Absolutely.
Um, I only kind of found it after I finished. I
Yeah.
started the day or a couple of days after I finished uni.
Yeah.
But it's been crazy. I
There's
can't
a big
imagine.
community. People like teeth. Like in terms of social media, teeth related stuff are very popular.
Mm. What was your major in undergrad? We'll leave that as
Biology.
your last question.
Biology.
Biology, yeah,
Yep.
makes sense.
Bachelor.
Make your life easy. Make it easy.
Yes, absolutely. It's just you know the language, you know a lot of the basic stuff that you can build upon.
Yeah. Well, thanks for coming on, man. I think we're going to get cut off if we carry it any
Yeah,
further.
absolutely. Thank
Um,
you.
Hopefully we'll catch up soon. It's been
Absolutely.
good.
All right, man. Take care.
Thank you.
You're welcome.
Thank you to everyone who's asked us questions. Make sure you're following Mo if you're not already. Make sure you're following my accounts if you're not already. Turn on live notifications because we're going live every single day until the lockdown ends, and then probably after as well. Uh, Thank you guys. Awesome.
All right, take care.
Take care. Bye.